A lot of companies, and I think it's true, will say that their people are their greatest strength. And so what we've asked of our team over the course of the last 7 or 8 months has been challenging and difficult and extra. But every step of the way, they've come through, and not even with just the bare minimum, just exceeded expectations and done above and beyond. Right from the beginning, we enacted many different safety precautions, both in the office, at our apartment communities, as well as our senior living communities, with restricting initially anyone coming into the office in the apartment communities. Obviously in the senior living, we had to have staff there with our residents.
The average age of our residents in our independent, assisted, and memory care communities is in the mid-80s. So obviously we're dealing with residents who have compromised health systems and other issues. So we take the health and safety of our residents very seriously.
We secured additional vendors and suppliers for our PPE, as well as start times, the shifts for some of the maintenance staff. We reduced hours in the beginning of the shutdown, and that seemed to, it was all to help our staff keep everyone safe.
There's so many regulations on what we can't do, but I've been really trying to help my team and encourage the other associates and residents to really focus on there are things we can do. It may not be what it used to be, but how can we adapt? How can we modify it and make it the best engagement and experience with what we are able to do? And that's really been something that has been in the forefront of our associates' minds.
You know, this whole thing has really focused on technology in a lot of different areas, and access into our office was one of them. So we did have a reader that you used a fingerprint to unlock a door and gain access into the suite. Well, we realized that probably was not a great idea with contact. So what they did is they implemented a system where we now use an app on our phone and present the phone to that reader, and it unlocks the door.
Interactions have changed a lot between associates the last several months, going from in-person meetings to phone conferences to video conferences. And I think that as we've been in this now for many, many months, more and more people are comfortable with the video conferences versus just the phone. And that was one major thing I think in the beginning that helped us, is getting people looking at each other on camera versus just over the phone.
All of our leasing staff actually has iPads. That has made it tremendously easy for them, to kind of have the information literally at their fingertips when doing a tour, a lease signing, anything of that nature. What has been very cool too with the iPads is we can FaceTime right from them. So if somebody was a prospective resident, for instance, was wanting a virtual tour, we can actually take them around via FaceTime or Zoom call or Skype, and take them around the apartment without them even being there. So that has been huge.
One of the technologies that we've been using has been Docusign to sign purchase agreements. Typically that's a momentous occasion for the buyer. It's very exciting to actually physically sign the paper. If you've ever bought a house, you definitely know what I'm talking about. With the pandemic, we've gone virtual. Instead of sitting down with our sales manager, buyers are now sitting at their computer at home signing the purchase agreement. So we really want to make sure we're trying to maintain that experience of buying a home. So to accommodate that, we've done virtual conferencing with people so that our sales managers can be available for questions and to talk them through the process while they're signing. So we're trying to balance the convenience and the safety of using Docusign with the experience of buying a home.
Every associate and every resident is handling this pandemic the best that they can, and everyone has their own personal viewpoints and struggles and challenges and good things that have come from the pandemic. So really just supporting them, listening to them, being their feet to go get them supplies so that they can engage with the residents, kind of just it's whatever it takes mentality at this point is what I'm doing to support the team and the residents.
In an environment like today, you got to make sure that you're taking care of the people that signed up for us to take care of them. What's most important is, are we doing things on a daily basis that's going to positively impact the health and future outcomes of all of our residents and our team? And that's what we ask ourselves every day when we make a decision. Is this to the benefit of everyone? This is not going to last for the rest of our life, right? This is hopefully a shorter term event that one day we'll turn the page, and when we look back, did we make the right decisions?